Dear audience, Assalamu alaikum. I am Professor Shamsud, Professor of Pathology. I welcome all in today's lecture on pathology. This is the 16th lecture on pathology. In the last lecture, I have told you about the changes in vascular flow and caliber in acute inflammation, and it was my day 1 lecture on inflammation. Today, day 2 lecture on inflammation. Day 2 lecture on inflammation continued. Today's topic is changes in vascular permeability. So, changes in vascular permeability in acute inflammation. Dear audience, we know this is blood vessel in the tissue. This is the endothelial lining. This is endothelial lining. You know, through the interendothelial junction, certain amount of fluid comes out in the tissue in normal physiological condition. Again, we can repeat, in normal physiological condition, certain amount of fluid comes out of blood vessel through the interendothelial junction in the tissue. But in case of acute inflammation, at the site of acute inflammation, this fluid that comes out of blood vessel in the tissue is increased. That is, in physical condition, each and every capillary is a bit permeable. But in acute inflammation, this permeability is changed. What is the change? Change is increased vascular permeability. So, in normal physical condition, there was normal permeability of blood vessels. This normal permeability is changed to increase. That is increased vascular permeability in acute inflammation at the site of inflammation. Now come to what are the causes of increased vascular permeability at the site of acute inflammation. Causes of increased vascular permeability. The number 1 cause is endothelial contraction. Endothelial contraction. Dear audience, suppose this is capillary. This is the endothelial lining like this. If there is contraction of endothelium, there will be increased gap in between two endothelium, and there will be increased vascular permeability. The second cause is endothelial retraction. Endothelial retraction. Dear audience, if there is endothelial retraction, there is increased gap in between the endothelium, and there will be increased vascular permeability. Then, direct endothelial injury. Direct endothelial injury. How directly endothelium may be injured? What are the causes of direct endothelial injury? Causes of direct endothelial injury, it may be due to trauma. Trauma may cause direct endothelial injury. Bacterial toxin. Like the example of bacterial toxin, like as in septicemia. Another cause, immunological reactions. Immunological reactions. Dear audience, you know, reaction between antigen and antibody is called immunological reactions, and this reaction may lead to direct endothelial injury. Another cause, leukocyte dependent endothelial injury. So these are the causes of direct endothelial injury. Dear audience, if this is the blood vessel again, this is the endothelial lining. If there is endothelial injury, whatever may be the cause, if the endothelial become injured here, there is increased gap, and through the increased gap, more and more fluid comes out of the blood vessel along with the plasma protein. Direct endothelial injury, another cause of increased vascular permeability is increased transcytosis. Increased transcytosis. Dear audience, you know, this is the capillary blood vessel lined by endothelium. You know, through the endothelium there is formation of channel, and through this channel, fluid may come out of blood vessel. This is called transcytosis. If transcytosis is increased, this is nothing but increased vascular permeability. So these are the different causes of increased vascular permeability. Now come to nature of increased vascular permeability. Now come to nature of increased vascular permeability. There are three natures of increased vascular permeability. Number one, immediate transient type of increased vascular permeability. What it means? It means at the site of acute inflammation, there is beginning of increased vascular permeability just at onset of acute inflammation. It means beginning of increased vascular permeability just at onset of acute inflammation. As it begins just at onset of acute inflammation, it is called immediate. So it is called immediate type. Why called transient? And this increased vascular permeability persists for a few hours only. So immediately there is increased vascular permeability, but this permeability persists for a few hours. So it is called transient. So this is immediate transient type of increased vascular permeability. We can cite an example: acute allergic rhinitis. Dear audience, you know, if anybody is exposed to allergen or dust on the nasal mucosa, there is sneezing and there is running nose. The running nose is due to increased vascular permeability. It begins just at onset of acute inflammation caused by the dust, and it persists for few hours. So this is an example of immediate transient type of increased vascular permeability. Number two, immediate sustained, immediate sustained type of increased vascular permeability. What it means? It means beginning of increased vascular permeability just at onset of acute inflammation. So it is called immediate. Why called sustained? The permeability persist for long time, even a few days. So it is called sustained type. Now come to example of immediate sustained type of increased vascular permeability. We can cite an example burn. Dear audience, you know, if anybody suffers from burn, there is formation of blister, and within the blister there is fluid. What is the source of fluid? This fluid of the blister is nothing but due to increased vascular permeability. Suppose this is a blister on the skin surface and it contains fluid. This fluid is due to increased vascular permeability. If it ruptures, there is oozing, and this oozing or watering persists for a long time, for a few days. So this is an example of immediate sustained type of increased vascular permeability. Number 3, delayed prolonged type of increased vascular permeability. What it means? It means beginning of increased vascular permeability after a long time of onset of acute inflammation. Beginning of increased vascular permeability after a long time of onset of acute inflammation. So it is called delayed type. Why called prolonged? Although it begins after a long time of onset of acute inflammation, it persists for long time. So it is called prolonged. It is delayed and prolonged type of immediate increased vascular permeability. Now come to example of delayed prolonged type of increased vascular permeability. We know if cancer bearing patient is treated by radiotherapy, you know the radiation causes acute inflammation in the skin. After a long time of acute inflammation in the skin, there is oozing or watering from the inflamed skin. So increased vascular permeability begins after a long time of exposure or long time of onset of acute inflammation in the skin. So this is an example of delayed and prolonged type of increased vascular permeability. It is found in skin following radiation of cancer-bearing patient. So this is changes in vascular permeability, that is increased vascular permeability in acute inflammation. Dear audience, again we can show the blood vessel like this, endothelial lining. If increased vascular permeability is here, what will happen? In the tissue, what will happen? There will be fluid, and the fluid contains plasma protein. Because normally plasma protein cannot come out of the blood vessel through the normal interendothelial junction. As the interendothelial junction is increased, gap is increased due to any sorts of causes, there is increased vascular permeability, and through the increased gap, plasma protein comes out. This is nothing but, it is called exudate. And this exudate in the tissue makes tissue swelling in acute inflammation. Dear audience, now come to exudates. What is exudate? We can define exudate. What is exudate? Extravascular protein rich fluid. It is extravascular protein rich fluid results from increased vascular permeability. Extravascular protein rich fluid results from increased vascular permeability is called exudate. So this is exudates. It is rich with plasma protein, rich with protein. So extravascular protein rich fluid results from increased vascular permeability is called exudates. Another term, transudate. Now come to transudate. What is transudates? It is also extravascular fluid, but it is not rich with protein. So extravascular fluid results from increased hydrostatic pressure in blood is called transudates. Extravascular fluid results from increased hydrostatic pressure in blood is called transudates. Dear audience, you know this is blood vessel, endothelial lining. Within the blood vessel there are two types of pressure. One is hydrostatic pressure, another is colloidal osmotic pressure. Colloidal osmotic pressure more than 80% is maintained by albumin, and this colloidal osmotic pressure draws water from outside to inside, and hydrostatic pressure opposite action, it throws water from the inside to outside. If increased hydrostatic pressure within the blood, what will happen? More and more fluid come out through the normal endothelial junction. If increased hydrostatic pressure in blood, more and more fluid come out of the blood vessel through the normal interendothelial junction, and this is called transudates. So it contains no protein, almost it content of protein is nil. Now come to differences between exudates and transudates. Exudates and transudates. What are the differences? Number one, protein content. Protein content in exudates and in transudates. High content of protein like plasma. Low content of protein. Clot formation. If we take transudate in test tube and exudate in test tube, suppose this is exudates in test tube and this is transudate in a test tube, we will see clot formation in the exudates, not in the transudate. So clot is formed. Clot is formed. Why clot is formed in exudate? Because exudates contains plasma protein. Among the plasma protein there is presence of fibrinogen. Due to presence of fibrinogen, exudates clot. Clot is not formed. Clot is not formed. And the difference, inflammatory cells. Dear audience, I have told you exudates is formed due to increased vascular permeability, and this increased vascularity is due to endothelial injury or increased gap between two endothelium. As the gap between endothelium is increased, so along with plasma protein, formed elements like leukocytes, WBC come out of blood vessel in the tissue, and these are called inflammatory cells. So inflammatory cells is found in exudate like neutrophil, eosinophil and basophil. But inflammatory cell is absent, but in case of exudate present. Another difference is specific gravity. A specific gravity of exudates is high. It is more than 1020. Why specific gravity is high? The specific gravity of exudate high is due to presence of plasma protein and cells within the exudates. But in case of transudates, low specific gravity. So these are the differences between exudates and transudates. Now come to, dear audience, we know at the site of acute inflammation there is formation of exudates. There is formation of exudates at the site of acute inflammation. What are the merits and demerits of exudates? Now come to merits of exudates. Merits of exudates. Merits of exudates. Number one merit is it dilutes the irritant. That is the injurious agent that is associated with acute inflammation. This injurious agent is nothing but the irritant. The irritant is diluted by exudate. If the irritant is diluted by exudate, what will happen there? The irritation at the site of acute inflammation will be diminished. So it diminishes irritation at the site of acute inflammation. Dear audience, we can give an example. If anybody is exposed to foreign particles or dust on the eye, there will be irritation. And when there is watering from the eye, this watering is nothing but exudate, there will be diminishing of the irritation. So it dilutes the irritants in the eyeball and diminishes the irritation. Another role on merit, it destroys the causative agent of infection. It destroys the causative agent of infection. Dear audience, I have told you, infection is nothing but inflammation. There is inflammation when caused by microorganism, then it is called infection. Another merit, it wallops the causative agent. Wallops the causative agent. Another merit, exudate carries antibodies at the site of acute inflammation. It carries antibiotics. It carries antibiotics at the site of acute inflammation. Dear audience, we can give an example of this. If anybody suffers from acute appendicitis, we give him or her antibiotic injectable form. If we give him or her injectable form intramuscular deltoid muscle antibiotic, there is appendicitis. This antibiotic from the deltoid muscle, how it enters at the site of acute inflammation in the appendix. This antibiotic is absorbed by blood, and the blood carries it at the site of acute inflammation, that is in the appendix in case of appendicitis. So it carries antibiotics at the site of acute inflammation. Another merit, it carries antibodies at the site of acute inflammation. Mechanism like before. Another merit, it prevents spread of infection. Dear audience, again I have told you, inflammation caused by microorganism is called infection. If anybody is infected, suppose my finger is infected by bacteria, this inflammation, and it will spread up. As there is formation of exudate, and exudate contains fibrinogen will clot here, and due to clot formed by the fibrinogen, this clot will prevent spread of infection off. So these are the merits. Now come to demerits of exudates. Demerits of exudates. What are the demerits? One demerit is exudate, or it carries nutrients at the site of acute inflammation. It carries nutrients at the site of acute inflammation. As it carries nutrients at the site of acute inflammation, if there is infection, the causative agent will get nutrients from the exudates, and there will be enhancement of infection, enhancement of inflammation. As it carries nutrients, the causative agent gets nutritions from the exudates, and there is enhancement of inflammation or enhancement of infection. So this is a merit, demerit. Now come to another demerit, adhesion of vital structures. Adhesion of vital structures. As we know, exudate can clot. If exudate is formed in between two vital structures, due to clotting of exudate with the help of fibrinogen, the two vital structures may be adherent. Example of this: example of adhesion between vital structures, acute pericarditis. Acute pericarditis. Dear audience, you know, if this is heart, you know this. If this is heart, you know, heart has two layers of pericardium, visceral and parietal. Visceral and parietal. If there is acute pericarditis, there will be a formation of exudates in between the two pericardium. If the two pericardium is formation of exudates in between two pericardium, two critical layers. If the exudates clots, there will be adhesion between parietal and visceral pericardium, and will lead to constrictive pericarditis. So adhesion leads to constrictive pericarditis. So this is demerits of exudates. Dear audience, you know, if this is the visceral pericardium and if this is the parietal pericardium, in between two there is exudates. If we can make a slice like this slice contains like this. Like this, there is exudates. It looks like two bread slides. Within the two bread slides there is butter. So it is called bread and butter type of pericarditis. Another example of adhesion between two vital structures, acute meningitis, pyogenic meningitis, or simply pyogenic meningitis. Acute pyogenic meningitis or simply pyogenic meningitis. You know, if there is meningitis, there is formation of exudates. If the exudates clots, there will be disturbance of flow of CSF. Pathway of flow will be occluded. Pathway of flow of CSF will be obstructed. So in pyogenic meningitis, what will happen? As adhesion of meninges due to exudates in CSF. As there is adhesion of meninges due to exudates in CSF, what will happen? There will be accumulation of CSF and it will lead to hydrocephalus. And this is known as non-communicating hydrocephalus. Non-communicating hydrocephalus. Dear audience, as this hydrocephalus is due to non-communication, due to adhesion of meninges, it is called non-communicating hydrocephalus. Another type of hydrocephalus, it is communicating hydrocephalus. There is no obstruction in the pathway, but excess synthesis and secretion of or formation of CSF. If increased formation of CSF leads to hydrocephalus, it is called communicating hydrocephalus. And here there is normal formation of his CSF, but there is adhesion between of meninges due to exudates, and it will lead to hydrocephalus. It is called non-communicating hydrocephalus. So these are the demerits of exudates. Dear audience, today up to this, thanks all.